Common diseases of ferrets. If you are the owner of a ferret, or you are doing research on ferrets before you purchase one of the most important things you want to know about is regarding ferret diseases. One of the most common diseases that ferret owners encounter with their pet ferrets is adrenal disease. The most common symptoms of adrenal disease in ferrets include the loss of hair, increased sleep habits, a decrease in appetite, and a decrease in the amount of coordination that the ferret has in the hindquarter region. With the female ferret, it is also likely that the genitalia region will be enlarged if the ferret is suffering from adrenal disease. The genitalia will have an appearance quite similar to a female ferret's genitalia that is currently in heat. It is also possible that your ferret could be suffering from adrenal disease but have absolutely no signs or symptoms present at all. For this reason, it is important that you have your ferret checked out by a veterinarian on a regular basis. Lymphoma is a common illness among ferrets as well. Lymphoma is a cancer of the lymphatic system and can be in two different forms. There is the classic form of lymphoma or the juvenile form of lymphoma. The classic form of lymphoma is generally more typical in older ferrets, where juvenile lymphoma is more typical in young ferrets. As far as signs or symptoms are concerned, it is likely that there will be none until the condition has progressed. Once this occurs, it is likely that your ferret will suddenly become very ill. An enlarged spleen is also a common illness among ferrets. However, there are two different cases with this illness. It is common for ferrets to have an enlarged spleen but show no signs of discomfort. In these cases, your veterinarian will advise you to leave the enlarged spleen alone. This is because it is less harmful to the ferret to leave the enlarged spleen intact than to remove the spleen. If the ferret is behaving normally, you should not have the spleen removed. You could harm the ferret more by removing it than by leaving it intact. However, if your ferret shows signs of discomfort, then you may want to speak with your veterinarian about having your ferret's spleen removed. You should watch for a decrease in hunger, a decrease in your ferret's activeness, and an increase in your ferret's sleep patterns. If these signs and symptoms occur, then it may be necessary to have your ferret's spleen removed in order to alleviate any discomfort that the ferret may be having. For more information, visit ferretcarecenter.com.